All right, y'all, welcome back to Level the Playing Field. I want to get into some myths about ACLs, and I got a few I looked up online. We're going to discount them and make sure y'all got the appropriate information. So like and subscribe, follow along, make sure you get the right stuff. Let's get it. So I'm looking online here, man. The computer says a few things about ACLs that are frankly untrue. So I want to make sure y'all are knowing exactly what you need to know about this important knee injury, the anterior cruciate ligament, and how it can affect your life. So I got 5 top myths that the computer told me. Let's see what it's got. So number 1, ACL injuries cannot happen without contact. So let me give you some background on where this question is coming from. So basically the question is asking, or what it's saying, is that someone has to hit you for you to tear your ACL. So playing football or something, you get tackled, you injure your knee, then you tear your ACL. That is absolutely not true. And I'll tell you, probably the majority of ACL injuries are non-contact, meaning no one actually hits the player who gets injured. It happens usually during quickly stopping and starting or suddenly changing direction. So suddenly changing direction can put force onto the knee, which then can translate to injury to the ACL. And remember, the ACL from the previous video is a key ligament from keeping your knee stable. It keeps your tibia from shifting on your femur. Okay, so when people change directions quickly, they can injure their ACL even just with that. If they like land awkwardly, or if they shift or they change direction, they weren't expecting it, these are all risk factors to tearing your ACL. So that is absolutely a myth. The most common way to tear your ACL is actually non-contact, and you don't actually have to be hit for it to happen. Next myth, surgery is the only option for an ACL tear. That is absolutely untrue once again. So you probably have heard about people having surgery for the ACL, and that is absolutely a very common treatment. But there's a few different ways that surgery can go. I want to break that down and explain to you why some people don't even have surgery at all. So once again, the ACL is a stabilizer of the knee. How we treat your ACL depends on how that stability affects you as an individual. So for some people, cutting and pivoting activity is not something they're going to be doing. And so the ACL, while I'm not saying it's not important, of course it's crucial, it may not be crucial to their lifestyle. So for instance, if you're somebody who, say, you're passionate about cycling, riding a bike, that's not necessarily a very high use activity for your ACL. So someone like that may consider rehabilitation or physical therapy, strengthening the ligaments around or really the muscles around their knee to make their knee stable through that strength and not necessarily worry as much about the ACL. The other thing I'll point out to you, there are some people who we call copers, coper, like being able to cope, and they have a natural ability to keep their knee stable even with an ACL injury. There have been people who have even, played high-level sports that with a torn ACL never has surgery. Even though the ACL itself may not heal in most cases completely, they've found a way to work around it through strengthening the muscles around their knee, be it with physical therapy or training or what have you. Now, the most common surgery for an ACL is to do what's called an ACL reconstruction. Y'all have seen the previous videos on that. I'm not gonna go into details here, but long story short, it's basically replacing the ACL and building a new one using tissue from elsewhere in the body or from a donor in some cases, but usually from your own body. The ACL reconstruction, of course, is a long-term, a long recovery to come back from, which we're gonna get at in the next myth, I think, or next 2 myths. Now, some people will actually do what's called the ACL repair, wherein you're actually fixing the ACL back in place. Rather than replacing it, it's kind of maintaining the ACL that's there and putting it back in place. Now, there are a lot of different circumstances under which that will not work out so well. And it's not necessarily that commonly done, or it's not necessarily as commonly done as a reconstruction for a few reasons that are probably too detailed for this discussion. But going back to the myth, it's absolutely not true that everyone who tears the ACL has to have surgery. If you're not going to be doing cutting, pivoting activities, that's a reason to not have surgery. If your knee is really not unstable, right, and you're able to work around it through strengthening around your knee, that's a reason to not have surgery. And although the ACL does not usually heal itself, there are cases in which it will heal itself. It is possible. So nothing's outside the realm of possibility. Remember, doctors, we're just people. We can't predict everything that happens to every person. We can only tell you what happens to most people in a given situation. So while most people are not necessarily going to have a full healing of their ACL without something being done, it can happen, in which case surgery is not needed, of course. So the underlying reason to have surgery or not is if the instability from the ACL tear affects you in the way that you do things. If you do a cutting pivoting sport, you playing that sport without an ACL that's fully healed is not really advisable because that could lead to other injuries to your knee. So that's a whole different situation. And that's gonna probably lean you more towards the surgery direction. But every person is individualized, and what you do depends on a conversation between you and your doctor. There's no cookie cutter answers in medicine, and certainly not in sports medicine. So we cut that myth down. I think that's done. All right, myth number 3, you cannot prevent an ACL injury. Once again, completely false. A lot of resources and information and study and research have gone into figuring out how to prevent ACL injuries. And why is that so critical? Well, the ACL is so important to your knee that an injury to it can affect your body long term. Now, in another video, we talked about things like post-traumatic arthritis and how that can affect your knee. Post-traumatic arthritis being when your cartilage or your kind of knee bearing surface breaks down with time because you had an injury of your knee previously. So if you tear your ACL, your risk for arthritis in that knee is dramatically higher than if you had never had that injury. And that doesn't matter if we do surgery, rehab, or what, that risk is still high. So obviously, we want to be able to prevent as many injuries as we can, because not only are there terrible short-term implications to tearing your ACL, missing out on your sport, pain, having to go through either surgery or rehab or both, right? But there's long-term implications that could affect your knee health for the rest of your life. So if we can prevent injury from happening in the first place, of course we want to try and do that. So we found, of course, that strength training, plyometric training, working on balance and coordination, especially in younger athletes and youth athletes, can really help to prevent injuries. And so the more we focus on that, integrating these things into their programs, into their conditioning programs for sports, making sure athletes, young athletes, are not playing the same sport year round, but are kind of not over specializing, but working on different aspects of their body and not just focusing on one thing from an early age. These are all things that we can do to prevent ACL injuries, and we absolutely must try to prevent them as much as we can so they don't have the side effects or the downward effects of having torn it later on. So that's another myth. I think we cut that down effectively. Recovery from an ACL surgery is quick. That's myth number 4. Recovery from an ACL surgery is quick. Recovery from an ACL surgery is absolutely not quick. There's nothing quick about it. Now, the surgery itself might seem kind of quick. The surgery itself probably takes about 60 minutes, thereabouts. So you can call that quick. Usually it's in and out, same day procedure or outpatient procedure, we call it, meaning you come in, you have the procedure, you go home the same day. Yeah, that's the only quick thing about it. The rehab process to come back from an ACL, especially if you're trying to play sports again, go ahead and bank on about a year, especially for a younger athlete. And what we found is that for younger athletes in particular, waiting a year or longer actually helps decrease your risk for re-injuring your ACL. So why does it take so long? We did this in another video, but just to give you the high points, it takes so long because right after surgery, you have to first off get the motion back into your knee. So your knee is going to have some aspect of stiffness after having a major surgery. And so you'll be usually in physical therapy or rehab working on, restoring that range of motion right away. Once you've done that, we got to get the muscles in your leg strong enough to protect you moving forward. And those muscles have to be retrained because they've been through a massive trauma, having first had the injury and then had surgery. So coming back from that part of things, getting the muscles strong enough takes months. And then once you've done that, then you have to get back to doing the sports activities that you do. So if you play soccer, you got to be able to safely, of course, kick and dribble the ball around. And that's just getting you individually working on your thing. For you to then play against somebody else is a whole nother thing, which takes a process of repeated testing of your strength and making sure that you are safe to play in a competitive situation. So all that will take, for a lot of cases, about a year. Call it 10 months, call it 16 months. Let's call it a year on average. So if a year is quick to you, then I guess the ACL recovery is quick. But for most of us, that's not a quick recovery at all. So that'll cut back on number 4 there. And then number 5, we got at this earlier, but this is kind of a recap. Once you've had an ACL reconstruction, it's as good as new. That is absolutely false. So nothing can make your knee like it was before the injury. And I tell my patients this before surgery: I cannot make you like your ACL was when you were born. That's not possible. A reconstruction is a well-studied and well-performing procedure with good outcomes, and it's been studied a lot for decades. And it makes a lot of sense for people who need knee stability, who are unstable after an ACL tear. It can be very, very successful in terms of getting you back to playing a sport, to having a stable knee, to living a life where you don't have to worry about your knee giving way on you. It's very successful at that. But for your knee to be exactly like it was before you were injured, it's not a possibility. No doctor can do that. We're just people. And a lot of times we have to kind of take into account or come to terms with the fact that there are some things in medicine we just can't change permanently. Now, we can certainly do everything we can to make it so you are as functional and able to move as possible. And that is our goal when we're doing any kind of surgery, really, is to get you to a point where you can do what you want to do the best that you can. But to say that you're going to have an ACL reconstruction and then forget about your knee and never think about it again doesn't really happen. Now, what I tell a lot of patients, even after they've finished all their rehab and they're done seeing me and they don't need me anymore, I say, hey, yo, look, this is a lifestyle affecting event. This is a life event, let's say it like that, an ACL tear is. With any life event, you really have to change the way your life goes moving forward. So if you tear your ACL, you go through the process, you rehab through it, you get back to where you're doing most of the things you want to do. You can't just stop doing, your strengthening exercises. You can't just forget about your knee. You got to keep on doing those exercises and make it part of your lifestyle. The same way as if you have high blood pressure, you need to check your blood pressure. You need to, check your salt intake and not take too much salt. If you have a knee injury, a serious knee injury, whether you have surgery or not, you have to change your life so that you are keeping strength around your knee for the rest of your life so you can stay mobile. So remember that an ACL tear is a life event. There's nothing quick or easy about it. And even if you have surgery to reconstruct it, it's not like things are right back to normal. So that goes all the way back to the last myth, or 2 myths ago, talking about prevention. Prevention is so key because even if we fix the ACL as perfectly as we think we can, you're never going to be exactly the same. So let's try and prevent those so you never have to see someone like me in the clinic. So those are the top 5 myths I pulled off the internet. I had to knock down the computer one time, a couple notches. We'll do this a few more times in the future. Let me know in the comments what kind of questions y'all have, what myths you want to see busted on here, and we'll talk next time. Level the playing field. Take it easy.